Hello, we are the team that developed the alignment device for capturing the geometry of the lower limb. This is our senior capstone project at the University of Iowa. The problem statement we are given is, it is difficult to utilize scanning technology for orthotic devices that are currently used for prosthetics, as capturing the foot and ankle in a functional position is difficult. The goal will be to design an alignment jig for the lower extremity to hold the foot and ankle in a functional position so that it can be scanned with a structure scanner effectively. Orthotists create ankle-foot orthoses, or AFOs, for patients with neuromuscular diseases and patients with other foot conditions, such as drop foot or club foot. Currently, orthotists utilize the method of casting, which involves taking a plaster mold of the patient and then making a positive mold, seen in the image in the top left, from this, and then modifications are made from there for the patient's specific requirements. This process takes about 1 week to get the mold out of the clinic to then be fabricated. Approximately 53,000 ankle-foot orthoses are fabricated each year, and because the casting process is time-consuming and requires a large amount of resources, orthotists are progressing towards using 3D scanners to capture the geometry of their patients' lower limbs instead of casting. The process of 3D scanning can be done with any structure scanner and takes approximately 1 minute to take, and then can be sent out digitally to be manufactured. The current problem with 3D scanning is that it is difficult for an orthotist to capture the geometry of the foot and ankle of a patient in a functional position to get an unimpeded 3D scan. The goal of this project is to develop a system for orthotists to capture that unimpeded 3D scan of the foot and ankle in a functional position to then fit patients with an ankle-foot orthosis.
The device our team designed is composed of 80/20 aluminum bars, 2 acrylic plates, 1 3D printed assembly, and 2 strands of 50-pound fishing line. The device is intended to be used with a patient lying flat on their stomach. It should be placed between their legs, and a blanket can be set under the leg not being scanned to allow the patient to remain comfortable. The orthotist should then lift the patient's leg to a 90-degree angle and lower the heel plate by loosening the lock. Once the heel plate contacts the heel, tighten the lock. The tensioning mechanism should be slid until it is directly under the forefoot. Once it is locked in place, the handles on the mechanism can be pulled out so that they become disengaged and free to rotate. After loosening the handles, the rectangular plate should be raised up so it is allowed to sit on the forefoot. To control internal and external rotation of the foot, the tension mechanism can slide until the desired position is reached. To control planar and dorsal flexion, both tension control knobs can simultaneously be tightened or loosened. To invert the foot, the inside tension control knob should be tightened. Similarly, to evert the foot, the outside tension control knob should be tightened. Once the orthotist has made all of the fine adjustments and is satisfied with the position, they can begin to capture an unimpeded 3D scan.
The results of the patient being scanned in the device are shown on the left, and with some quick post-modification software, we can remove the artifacts to yield the figure in the middle. Comparing it to a patient scanned outside of the device, we can see that there is just slight tissue depression on the hind and forefoot, and consulting with our mentor, he agreed that this is not an issue as an AFO is a load-bearing device. It is expected to have some tissue deformation. He has deemed this an acceptable scan to be used to create an AFO. With this, and satisfying all functional requirements, we have deemed this project to be a success.